Thank you. I am really very honored. I only regret that I never met Jessie, because I think we would have gotten along very well. Anybody who speaks truth to power is my kind of gal. Especially since what my real credential in life is that I am a recovering journalist. I think that for all of us, the most important message that comes out of Jessie's life, and hopefully out of the work we're all doing, is to get the patient in the room, to get the person in the room. And I should say that the Conversation Project is very interested in having these talks about the way you want to live at the end of your life, the way you want to live at the end of your life, and having them with people way before they are patients. Because as we all know, and certainly all of you who are in the cancer world know, when you have had a diagnosis, a crisis is a terrible time to learn. So we're encouraging people to get to the kitchen table, to have these conversations with the people they love, and to use our starter kit and some of our other starter kits as well in that time. I also think that when we talk about having these conversations early, to tell each other why. We need to have them early because it is always too soon until it is too late. We have also seen the culture change in just the short amount of time that we have been involved in this work. And I have to tell you that we started the Conversation Project right at the height of death panels. I hope you all remember death panels. And since then, we have written an obituary for the death panels. We have had the Medicare and Medicaid and now actually going to be paying clinicians for having these conversations with their patients. But the most important thing is for us to have them as people with each other. And that is really at the heart of the work that we are doing. I come to this work, well, I'll tell you, since we are a story-based project, I'll tell you my first story, which came, I am also in the way that many of us are, a survivor of a parent who died of cancer. And my father died of cancer when he was 57, and I was only 24. And I still remember to this day his last birthday, about 3 months before he died, when my mother gave him as a present luggage. Now, I don't know if that makes my family uniquely qualified for the Hall of Fame of denial. But in those days, that was what everybody did. Everybody denied. And I have to say, as you heard, that 30 years later, when my mother began to decline and she could no longer decide what she wanted to have for lunch, let alone what she wanted for health care, I was shocked to find myself in the situation of having to make decisions for her, when in fact we had never talked about it. Two people who had talked about everything. In fact, one of my favorite columns was when I wrote a column saying that my mother was the kind of person who would talk about my problems until I was bored with them. But in fact, we hadn't talked about this piece of the work. And that really inspired a lot of us. When I talk to people about the Conversation Project, it's remarkable to me with my journalist hat on, because there is half a beat and out comes a story. Half a beat. Everybody has a story about a good death or a hard death. And that universality of it has been released by the work that we and others have encouraged. That when people start telling these stories to each other, that's when a movement begins. That's when the women's movement began. That's when the gay rights movement began. That's when the work with cancer survivors begins. It's stories that drive that work and that encourage everybody to know what's going on. The other thing is that we believed in changing the healthcare system from the outside in. And the model for that really was how birth changed in America. Birth didn't change in America because the doctor said, oh, please come into the birthing room, let's have the baby in a bathtub, bring the video camera, bring the dads. It was not the doctors who said that. It was people saying, you know what? Birth is not just a medical experience. It's a human experience. And now increasingly what we are saying is that dying is not just a medical experience. It's a human experience. And we need all of your voices talking about that individually, talking about that with your healthcare providers, talking about that with policymakers, and spreading the word. And I think Jessie would have been a person who very much applauded that belief of getting our voices in the room. And I hope that we leave all of you with that thought tonight. And again, I want to thank you so much for this award, which I promise not to use to hurt anyone with it. Thank you so much.